Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Ruth Cabal. Today on the program, following the appeal of medical frontliners for a timeout, President Rodrigo Duterte orders the return of Metro Manila and nearby areas under modified enhanced community quarantine. Setting another single-day record-high number, the coronavirus cases breach the 100,000 mark in the country. And how should the government balance the need to restart the economy and keep the public healthy? Former COVID-19 Task Advisor Tony Leachon and Presidential Advisor for Entrepreneurship Joey Concepcion join us live. The government partly heeds the call of frontliners for tighter restrictions amid the surge in coronavirus cases in the country. President Rodrigo Duterte announced on Sunday night that starting tomorrow, August 4, Metro Manila and the provinces of Bulacan, Cavite, Laguna, and Rizal will again be under a modified enhanced community quarantine. Under the MECQ, any person below 21 years old or are 60 years old and above, as well as pregnant women and those with underlying health risks, are required to stay at home, except when obtaining essential goods and services, as well as reporting to work. This is a more relaxed lockdown compared to what medical societies wanted. They appealed for a 2-week ECQ, the country's strictest form of community quarantine. In his address to the nation, Mr. Duterte insists that the government is not lacking in its COVID-19 response. The president gives no guarantee that the public will receive assistance in the 2-week MECQ. Here's the president in his own words.
Sorry, Manila. Ngayon, magsabi kayo, i-lockdown mo na ang Manila. Ang ibang lugar, entire Philippines, para talagang wala nang mahawa. Wala ka nang mahawaan, wala ka nang mahawa. Problem is, wala na tayong pera. I cannot give food anymore and money to people.
Let's go straight to the source of the story, former COVID-19 Response Task Force Advisor, Dr. Tony Leachon. Good morning, Dr. Leachon, and thank you for joining us.
Good morning, Ruth. Good morning.
Okay, Doctor, una muna, can we just get your reaction? The president heeded the medical frontliners' call for ECQ, although the declaration was for MECQ. So what can you say about that?
Well, we're glad that the president listened to the voice of the medical community, and we are receptive of that particular decision of the MECQ. I think this is the right approach that the medical community should partner with the government. We expected the MECQ, considering the tight balance between the health and the economy. But the medical community's position was basically push for the ECQ because we think that the viral transmission will be more controlled, just like in the Cebu experience when they had these acute cases rising up. Now with 103,000 total cases right now and 5,000 cases per day, the medical community think that the ECQ for 2 weeks will be enough to lower down the reproductive number of 1.79 to 1, just like in Cebu from 2 to 1, and then at the same time increase or build up the healthcare capacity for detection, testing, isolation, and of course contact tracing while we are on the lockdown. So if the decision of the president is MECQ, I expected that because during the time when I was invited by the office of the president on July 15, my position was really for the ECQ. But I heard the president that the National Capital Region mayors requested Secretary Anyon, Secretary Galvez for GCQ. So I thought the GCQ may not be effective considering we're on GCQ for a month and the cases are still going up. So I think anything lower than the GCQ, an MECQ or a ECQ would be a welcome development for the medical community.
Doc, let me just go back to what you said na, well, at least kung MECQ, this was something you expected, but you would have wanted talaga ECQ. So anong effect naman po ang pwede if we're just on MECQ? Can this really flatten the curve for 2 weeks?
Right. The projection of the UP research group, I had a discussion with Professor Ranjit Rai last night. If the measures will not be put in place and this will be unabated, the projection of the UP Octa group will be about 150,000 cases and 4,000 deaths by end of August. Now, if it is on the GCQ, so at 5,000 cases, if the run rate will be a little bit lower, let's say 3,000, I expect that the cases will be around 130,000 by the end of the month. So therefore, the position of the medical societies would be an ECQ, so that you have a complete arrest of the transmission, and at the same time, the reason for this is that the hospitals are actually full, and the doctors are right now fatigued and weary, and some of the hospitals and the doctors are also confined. You know that Hospital na Maynila right now is closed
Close,
for
yes.
this infection, and of course the medical staff are also affected. And you can see here might be a domino principle in the next 2 weeks if the GCQ will be maintained. And that's basically the reason. So just to summarize, we want an arrest of the new cases, number one, because it's difficult right now considering in March we had only 100 cases and we were on ECQ. Right now, we have 100,000 cases and 5,000 cases per day after 5 months. The healthcare capacities right now, maybe I would say 70% okay. That's the reason why we have lesser deaths right now. And of course, the support on the hospital level. But if there are increasing cases coming from the outside, you might overwhelm the system. A lot of the patients right now are being driven out because of the full capacity. And some of the non-COVID patients, those who are actually sick, like stroke, heart attack, cancer, those with diabetes, are not being entertained because of the allocation of the beds for COVID patients. And these are basically the reason why we push hard for the ECQ, at least for the next 2 weeks, and then gradually phasing down to MECQ for the next 2 weeks to really flatten the curve.
So kumbaga, in a way, magkakaroon siya ng effect but that's not what you're expecting. Kasi 'di ba sinabi niyo nga 150,000 by the end of the kung itutuloy yung GCQ, but now it could be just 130,000 by the end of August. Ganun po ba?
Tama
Makakahinga
po
ng
yun.
kaunti, parang ganon.
Tama po yun, Miss Ruth, na the projection of the UP mga 150, but we expect na less than 20,000 kung ma-MECQ. Ang reason lang naman natin kaya natin gustong mag-ECQ is basically mobility. Evidence have shown na pagka nag-ease down tayo ng quarantine, yung mobility ang
Yeah.
nagkakaproblema. Like sa Japan, yan 2 days ago, may report yan na because of the easing down of the restrictions nila, nagkaroon ng surge ngayon ho sa Japan. Ganyan din ho ang nangyayari sa Amerika, in the United States. You can see as they reopen the economy, the United States of America is still the number one in active cases and the number of deaths. So we have beautiful reference models of those who reopen the economy so fast and as they ease down also the quarantine classification.
Yung kasama din doon sa earlier calls is for the recalibration of yung strategy, di ba? Yung ginagawa ng gobyerno ngayon. When you say recalibration, ano ba ang dapat gawin? I think, I just want to mention one of the concerns that was raised din daw last night by medical groups, yung over-reliance doon sa antibody tests, and then yung lack of, where's that? Failure of case finding and isolation, failure of contact tracing. Ano po bang gusto nyong in terms of recalibration?
Ang recalibration is to use the gold standard na RT-PCR, considering marami tayong false negative and false positives with the rapid antibody test. And this may have actually contributed to the rise in the local transmission kasi naki-clear natin sila, kunyari negative sila,
Mm-mm.
pero in reality, talaga sila negative. Now, doon naman ho sa recalibration, we noticed that there are appointed SARs right now for testing, Secretary Vince Dizon, for isolation, Secretary Mark Villar, and then for treatment, Secretary Paul Vega, and then for contact tracing, Mayor
Magalong.
Benjamin Magalong.
Mhm.
Only Yusek Vega is a physician. Ang gusto sana ng medical community is to have a medical group supporting each particular SAR
Mhm.
so that they can actually be more effective and productive in doing their job. No? So we need to enlist more of the medical community to help the government. Particularly, this is a health epidemic
Mm.
at this point in time. Yun ho ang hinihingi nila na partnership so that they will be able to help out the government, particularly
Mhm.
the Department of Health. Now,
Mm.
Okay.
right now, it is overwhelmed.
Mhm. Okay, we'll talk more about what the president said last night, especially meron din siyang mga address to the medical frontliners. So we will get your reaction on that. Dr. Leachon will be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, former COVID-19 Task Force Advisor Tony Leachon. Doc, last night the president said he fully understands the concerns of our medical frontliners, but at the same time, he has some strong words against them. Let's listen in.
Magsabi kay revolution, then, ngayon na. Go ahead. Try it. Sirain natin itong patayin natin lahat ng may COVID. Is that what you want? We can always end our existence in this manner. The next time, huwag ninyo akong parigin-rigin ng revolution. Naku, Diyos ko. Yan ang mas delikado sa COVID. Kaya kung magrevolusyon kayo, you will give me the free ticket to stage a counter-revolution.
Doc Tony, can we get your reaction to that? Counter-revolution, nagsisigaw daw ng revolusyon. Ano pong masasabi niyo?
Well, I was not part of that Zoom meeting. We were just watching from the audience because the ones who spoke there were the presidents of the medical organization. But I support the medical community. It might seem to be some sort of a revolution to the eyes of the president, but it was not meant that way. You can actually articulate if you are actually in one group as a body rather than on a personal basis. You know that mass action, just like when we lobbied in the syntax for alcohol, tobacco, and so we create this coalition so that we partner with the government. I think the doctors are very patient and persevering and resilient. The doctors will not actually complain if they're not feeling fatigue and weary. And I think this is the primary reason that they actually present to the president their condition as the father of the country. And we expect as doctors that the president will be compassionate and empathetic to the pleas of the people. And of course, we would like to request also a recalibration of the plan in the first 100 days and move into the first 100 days on what the doctors can actually do and help the government. So we are not against the moves of the IATF and the moves of the president. We just like to be understood by the president that the medical community are having a hard time right now in trying to manage the avalanche of cases at the emergency room and also at the hospital level.
Dr. Leachon, recently there were also calls for the resignation of Health Secretary Duque, lalo na when we had like over 30,000 yung recoveries. Parang baka daw, there was something amiss with the data. But last night, the President said, virtually said, wala namang maling ginagawa si Secretary Duque. He did not import COVID, parang ganon. Ano pong masasabi niyo doon?
Well, the President really trusts the Secretary Duque, and we must respect the President's decision. And according to Secretary Duque, that he always work at the pleasure of the President, and we must respect the President for the confidence and trust in Secretary Duque. So we just have to accept that and live with it, while the people would actually step up to the plate and enable others to be healthy. The call for voluntary ECQ. The voluntary ECQ is made Filipinos not to be sick. We want to be healthy and observe the maximum na nga maximum health standards na natin, so that we will not be of burden of adding more cases and be admitted at the emergency room. So basically, whether the decision was ECQ, MECQ, or whatever it is, the mode basically of a Filipino citizen is to be on voluntary ECQ. So we will not add burden or problem to the country's healthcare system.
Nabanggit nyo na yung voluntary ECQ. For my last question, ano na lang ang panawagan nyo sa publiko? Kasi nakita ko yung mga post nyo kung anong dapat gawin when you're on voluntary ECQ. No? Since we're just on MECQ and we didn't get the ECQ that you requested, ano pong apela nyo sa publiko during this MECQ period?
Okay. Ang kailangan natin gawin is not really to have mass actions and mass gatherings. If you're senior citizens and all, you don't go to the restaurants and expose yourself, particularly those with comorbid conditions. We have arranged, of course, with the church, about siguro 2 hours before the announcement of the Archdiocese of Manila, Bishop Rodrigo Duterte, Father Rolly de Guzman talked to me, and I gave the manifesto of the PCP, and they volunteered as well that their church activities will be lessened because of the pleas of the medical societies. So basically, we would like, of course, to limit the viral transmission by less gathering, by less movement, and of course, wearing the mask, and of course, the hand washing and all the face shielders na gagamitin natin. Ang pananawagan po ng mga doktor ngayon, ang mode ho natin ay parang katulad ho nung March na mag-ingat tayo. Kasi kahit doon, kukunti pa lang case, sobrang ingat na natin. Mas lalo na ngayon ho tayo mag-ingat kasi 5,000 cases a day po ito.
Yes.
At airborne pa ang isa sa kinukonsider nating problema. Marami ring asymptomatic cases na naglalakad. So doble ingat natin ho ngayon. At hindi biro-biro ang numero hong tinatala sa araw-araw, 5,000 cases. Ngayon po ang total 103 cases. At hindi pa natin nafa-flatten ang curve. At hindi pa dumadating yung bakuna. So ang pananawagan ho ng mga doktor, stay healthy, voluntary ECQ mindset, so that we will not increase the viral transmission and be of burden as well as a problem to the doctors right now who are overwhelmed in the hospital setting.
Okay. Thank you very much to Dr. Tony Leachon.
Thank you very much.
How will the return to MECQ affect the economy, which was hardly recovered from the impact of the country's initial lockdowns? We talked to Presidential Advisor for Entrepreneurship, Joey Concepcion, after the break. You're watching The Source on CNN Philippines.